burnout for sure. Hello, everyone, and welcome to this episode of A Mind of Her Own. I'm so excited for my guest today, who's Dr. Carolyn Roy-Bornstein. She's a board-certified pediatrician, a former practicing nurse, author, and the current writer in residence at the Lawrence Family Medicine Residency Program. She has written multiple books, including her most recent, A Prescription for Burnout, Restorative Writing for Healthcare Professionals. Alongside this work, she has led writing workshops for hundreds of physicians, nurses, family caregivers, and many others who all suffer from stress and burnout in healthcare. I invited her today because I'm a strong proponent of narrative medicine, and I wanted to share her inspiring role in this field. So, Dr. Roy-Bornstein, thank you so much for joining me today.
Thank you for having me.
So maybe we can start. I'll tell you, my introduction to narrative medicine didn't occur until I think it was my fourth year of medical school. And I was at Columbia and happened to be sort of one of the four founding mothers of narrative medicine, Rita Sharon. And I just stumbled into a class with her, and there was something so amazing about sitting and talking about books and writing and ideas within my medical school curriculum. This was certainly a departure from other areas, and was exposed there, and just have always so admired her work and those who are trying to encourage people in healthcare to connect and write and use that in the ways that can help them with burnout. So could you just describe, how would you define narrative medicine so that listeners can understand what it means?
So I think in today's world, narrative medicine is described by different people in different ways. I know certain MFA programs, writing programs, have narrative medicine tracks. So that would be a completely different, I think they're talking about writing the body and writing about health and illness. Narrative medicine, as understood and described by Rita Sharon, I think could best be described as a commitment to patient stories, centering patient stories in our clinical exams. It's not a clinical practice per se, but it's a framework within which to practice clinical medicine, in which we endeavor to understand a patient's story, absorb that story, be moved to act on that story. And in narrative medicine, we do that in a very specific way, and that is through the arts and literature. So in a typical workshop, Columbia style, we would start with a poem or an essay or a story, or a visual work of art, and begin with a discussion. And I think that helps people who might be a little sketched out by jumping right into the writing, to give them a jumping off point to we're just discussing this piece of art. But so already in that process, we're sharing our experiences and our thoughts and feelings. So when we get into that writing, that sort of deeper level, there's built in sort of a comfort. And I think there's a lot of lofty goals that have morphed and developed along the way in narrative medicine, from patient outcomes to public health outcomes and health equity. My goal when I work with doctors and residents and nursing students is connection, is that third movement of narrative medicine, the affiliation. And I think what Rita Sharon had in mind was affiliation with the patient, affiliation with each other as a caregiving community, but I also see a connection with our deeper selves and our deeper values when I work with groups.
So it seems like, the book talks about this as a prescription for burnout. And maybe that's what you're getting to, is that connection with ourselves and also the community of providers around us. Why do you think narrative medicine could be a helpful prescription for burnout in this field?
So I think in the book uses just the reflective writing piece. We're not looking at art or reading poetry. And I think the reflective writing piece gives us agency in some ways. You're building a narrative, you're creating a work that you can then step back at and examine and look at and understand and interpret and return to, and see your personal growth along the way if you're choosing to do a daily writing practice. Um, So there's so there's that aspect of it. There's also, and I think you as a psychiatrist appreciate that um, externalizing painful emotions, that naming of emotions, has real um, physiologic roots. If we look at functional MRIs, we see that brain regions that activate with distress deactivate with externalizing or naming these emotions. So that's another way I think that reflective writing can help us.
I certainly agree with that. I think that was a big reason I wrote my book about guilt, was just to be able to name that that's what this feeling is, this sort of constant feeling that especially women, many women in healthcare, are experiencing throughout the day. And I agree, when you have a way to describe it, you take it out of the shadows and it's there in front of you to reflect on, to think about, to talk about. I wanted to go back a little bit into your personal history. And I know that you worked as a nurse for a decade, including, I heard in another podcast, overlapping with your first 2 years of medical school, which I think is so amazing. I mean, my background, my grandmother was a nurse alongside my father in their rural medicine practice, and she sort of ran the place. She was the boss. And certainly the nurses I've worked with in every setting sort of were the ones that sort of were taking control of the environment. We're setting the mood, I think, in the environment and working with patients. And so I'm just interested in how you think your experience as a nurse and then coming into medicine that way, and now with this work you do, you've got such an interesting frame, I think, for even understanding burnout and workplace culture. Just wondering what your thoughts are on that.
Yeah, I mean, I was working as a nurse when I was deciding to go to medical school, when I was taking those early organic chemistry and all that. And I'm not sure nursing had any advantage in those first couple of years of medical school or pre-med. But certainly when we got to the clinical years and just being comfortable with patients and knowing my way around a hospital or a clinic was certainly helpful. And it's certainly informed my teaching with the residents. I'm a big proponent of, if a nurse is worried, you should be worried. It can be easy that 16th call you get from a nurse about a Tylenol prescription. It can be easy to get frustrated or dismissive, but I think our intuition about patients' well-being is well worth paying attention to. So it was nice to have that perspective.
Yeah, I can remember countless situations where I was saved by a nurse in
Mhm.
residency as I was ordering something I shouldn't have, or just trying to learn and trying to understand things, and they had the wisdom of time and experience. One of the groups that I've been a part of that I think overlaps with narrative medicine is called Introspective Spaces, created by a physician and a nurse together as a way to cope with burnout, as a way to kind of build community. And I think what I've found so helpful about different programming they've had available is that we are all together, that the physicians and the nurses, physical therapists, massage therapists, other people are all together doing this as a group. But I'm wondering if you see, how you run your groups. Do they tend to be separated by specialty or by, track? And how it might be helpful for us to come together this way, because, we all have the same goal, which is, high quality patient care.
Yeah, I run different groups. I have groups that are just strictly residents and groups that are strictly women physicians. Um, One of my favorite groups to work with is the Brain Injury Association and brain injury meetings, because of this diversity that you just mentioned. In the audience might be neuroscientists, might be neurosurgeons, might be art therapists, music therapists, nurses, and there's also family caregivers. There's also brain injury survivors. And to have that, it's challenging as a group leader facilitator to present in a way that's applicable or that resonates with each of those groups. But I think the outcomes are are so rich. The discussions are so rich when all these different perspectives can come together.
Yeah. I'm wondering, I was chatting, I've got a number of family members who are in surgical fields and talking about just having the time and space, emotional space and others space to write, to reflect. The idea of journaling or taking the time to do this or being able to attend an actual brief class or workshop on this feels very far outside of their everyday, where it just seems like they are scheduled to the minute and so busy and find maybe some skepticism about the benefits of this work. And I'm wondering how you might respond to that, or what you've heard from maybe physicians and nurses and others about that skepticism, perhaps.
Sure. And I guess I would start with the science, with the evidence, with the studies, and starting way back with James Pennebaker at UT Austin with his college students and looking at the health benefits, the trips to the student health for sick visits were not just clinically significantly decreased, but dramatically decreased in college students who wrote about their deepest thoughts and feelings. There's been studies looking at patients with asthma whose pulmonary function studies dramatically improve, patients with arthritis whose not just subjective pain scales improve, but clinical joint exams by rheumatologists improve. There's CD4 counts and viral loads and all these measurable outcomes. And the reason I bring some of these up is in all of these studies, the amount of time spent writing is 15 to 20 minutes a day for as little as 4 days, 4 consecutive days. And in 4 months, 5 months, 6 months out, looking at follow-up, those benefits, the decreased perceived stress levels, decreased depressive symptoms, are sustained. So yes, there may always be skeptics. I've had people who say, but I'm not a writer. That's a common thing. And I try to be, I feel like it's my job to create a safe space where people feel they can write and share. And also to kind of level the playing field. Look, we are none of us Shakespeare here. That is not the point. And hopefully make people comfortable in that way. I was recently last month speaking at the AMWA meeting, the American Medical Women's Association, and there was a male face in the sea of women. And he participated, he wrote, he shared, he was with the discussion. And I thought I had seen him running AV equipment at the meeting. And so I tracked him down later in the day and I said, you were at my workshop? And he said, yeah. And I said, I, did I see you videotaping? Yeah, yeah, that was me. And I was, well, what did you get out of it? What drew you to it? And he said, I burnt out of architecture school. And I just wanted to figure it out. I just wanted to see if I could understand that more. And so it was really a wonderful addition to the discussion. And, I really applaud that kind of openness and encourage people to be open to the possibility that this is a welcoming modality to anyone who wants to give it a shot.
And the phrase narrative medicine, that we are by our nature, by our evolution, storytellers, and this is how we communicate. I'm wondering, for those people who maybe don't find the writing as helpful as maybe painting or sculpting or creating in other ways, do you bring any of those aspects or modalities into your workshops, or have recommendations for someone who might find that that's a more effective or just more comfortable way for them to express themselves?
Yeah, so that's actually been looked at. Pennebaker and his colleague Anne Krantz looked at other modalities such as dance, expressive movement in relieving stress, being an outlet. And what they found was that in order to have be most effective at these positive health outcomes, that the modality needed to include language. And there's a quote that Pennebaker has that pain is writing is pain turned into language and language turned into connection. So I think it's that language that we spoke about, that building of narrative, that ability to um, write something that we can then interpret and process. We can process events in a more meaningful way. Like some of these other modalities, the dance in this particular study, or the sculpting and art and painting that you describe, have their place, I'm sure. But in these studies, it was the language-based modalities that were the most effective for those reasons.
It's really interesting. Well, you've worked with all these different groups, including residents, so early in their training and process, and maybe later attendings or nurses who had been in practice for a while. I'm wondering if you see differences there. I mean, I think there are always these generational shifts in as we go along in these training programs, but differences between how the residents or maybe student nurses approach some of these ideas versus those who've been out in practice maybe for decades.
I guess I would say a couple of things. One is the physicians who have been at it a while, I see the burnout coming more from frustration and exhaustion, whereas in an earlier career practitioner might be struggling more with the disillusionment, it not measuring up to what they thought it would be. Um, but I think the beauty is that writing meets you where you are. Writing can wrap itself around any situation you bring to it. Um, so there may be differences in how you got there, but I think that writing can meet all of those different pathways. I mean, one thing that you mentioned, the generational differences, one thing I think is different from the way I was trained that I think is definitely changing now is there was either an explicit teaching or a hidden curriculum that said, don't get too close to your patients. Don't that it's a professional relationship. It's not a personal relationship. Don't share too much. Don't get too close. Set these boundaries. And I think that was designed in very well-intentioned way of protecting us. They thought that that would create burnout, that would open us up to burnout. When I think what we're coming to understand is that that is the key to mitigating burnout, that connection, that finding meaning in those relationships. So I think that's something that is maybe different in upcoming clinicians.
Yeah, that reminds me, there was a quote in your book from Dr. Sharon that or a quote, not a quote, but she had described that she advocates for, you write, a certain porousness in the clinician patient relationship, a permeability to the suffering of others. And admittedly, I do find, maybe mid career, you'd call me, I do find that a little intimidating, that it could kind of swallow me whole because I mean, there's certainly a big discussion around boundaries in psychiatry, very appropriately so, but also about us kind of being a bit of a blank slate and really making it about the patient. But this idea of being more porous to their suffering makes me a little anxious, I'll be honest. And so I'm wondering how you interpret that and how you guide clinicians who might be concerned about what that means.
Yeah, I have come to, my initial thought was exactly that, but I have come to believe that that is important, that permeability, that porousness, that ability to absorb those stories of illness. They're important for us to understand the patient, where the patient's coming from, to arrive at the correct diagnosis and the appropriate treatment. But I think the key is understanding that there's a certain suffering that it belongs to the patient. It doesn't belong to us. And that, I think, is what has been missing, is that we absorb this suffering, but no one has told us that we don't have to keep carrying it, that we can set it down. And I think reflective writing is a way that we can, it's almost a filter, right? We can absorb the suffering, let go of what doesn't belong to us while holding on to the meaning that we can extract from that encounter, that moment, that relationship with the patient. So that same permeability that allows that suffering in can allow it to be set down on the page.
That brings me to shifting maybe to a bit more of a personal discussion in your story. And you have written about a very difficult time in your life when your youngest son was in a car accident with his then girlfriend. And I'm wondering if you could just share a little bit about what happened and how turning to writing in that time was such a deep, helpful path for you.
Yeah, so um, I have four children, and Neil's my youngest son. And when he was 17, he was hit by a drunk driver who was also at the same high school that he and his girlfriend was at. And he was left with a serious traumatic brain injury, and his girlfriend was killed. And as you can imagine, it threw my family into turmoil. We all rallied around Neil, put one foot in front of the other, trying to get through this. For me, what I felt was the most difficult. There was the anger at the drunk driver, of course, who had caused all of this. Um, so writing was a way for me to process that and try to understand that. There was also an element of ambiguous loss or a disenfranchised kind of grief, which I didn't know the word for it at the time. I just knew that when I would talk to family or friends about Neil's, having a second surgery on his leg or going to a learning accommodations meeting to get special accommodations for high school or college, it was met with kind of, but he's alive, right? I felt that I wasn't the one whose child didn't survive, and I should be grateful for that, which I was, of course. But so that there was real loneliness in that, not really being able to talk to people without at least me feeling like that was the prevailing response. So writing really became for me a way to just process all of that. And eventually it became a way to make meaning when I began to publish essays in Disabilities Journal about how how invisible that disability, that particular disability can be at times. Um, I've published essays in medical journals for doctors like you and me about whether and how to share about this experience that I had. If I went through something with my son that could help you, should I share that? How should I share that? Writing for moms journals about watching your son mourn his girlfriend, the death of his girlfriend. Um, and all of those came with reader responses. I became an ambassador for the Brain Injury Association, so I did a lot of public speaking for them, and that connection of having people come up to me afterwards and describe their traumatic brain injury or their stroke or their infection or their family member. Um, it just brought back Pennebaker's writing as pain turned into story and story and turned into connection. And I mean, there are even MRI physiological evidence for that connection between writer and reader and storyteller and listener when our the same regions of our brain light up. And I just remember learning about that study and feeling validated because that described what I had experienced over and over so many times.
Yeah. I'm wondering about, during that time and the years beyond, as you're doing this work, and we're talking about porousness and connection and hearing other people's stories. And I'm wondering if there have been moments or times or ways that you've had to occasionally step back from it or take breaks or find other ways to, manage your own feelings or ever a sense of burnout within in that environment. Is there ever a time where working in this area was too much for a period, or has it really been something entirely sustaining for you?
Yeah, I think more the latter. I mean, I've been at this on and off, um, especially the public speaking part of it, the brain injury. Um, but I've always been open to um, reader feedback and audience feedback. And for me, that it's almost like in the word feed. It's kind of a nourishment hearing people's stories like that. In fact, I remember one brain injury conference, I was doing a writing workshop, and one of the people who had just finished writing, he wanted to share, and he did. And towards the end of what he was sharing, his story, he paused and he said, "Wow, I guess I'm grateful for my brain injury." I never thought of it that way before. And I find that a lot with writing workshops. There'll be this wow kind of moment where, wow, I never understood that before. So he was identifying gratitude. He was identifying the emotion that he was attaching to his experience.
Yeah, I'm wondering about other themes that have come up. I certainly hear that in therapy, those wow moments, and it's pretty miraculous when they happen, when they speak out loud. Again, that language connection. Are there other themes that have emerged that maybe have surprised you or kind of changed the way you look at, this process or in training, like ideas that it's given you about how we should be approaching incorporating this work into our field?
Yeah, I think the big one is in the self-awareness arena, that finally kind of identifying what it is about the interaction, the conversation that had been either troubling us or making us curious. I think it gives us a way to explore things that would go unexplored. And I think about Joan Didion, who everyone talks about that famous quote, I write entirely to find out what I'm thinking. And I, I don't think she meant she doesn't know what she's thinking until she writes it, but I do think that we don't fully always understand the impact that something has had on us for quite some time until we take the time to reflect upon it, and whether that's writing about it or just in a one-on-one session with you as a therapist or a psychiatrist, um, and really delving into it, that we realize, oh, I didn't know I was carrying that anger, that guilt, whatever it was. It does come to um, giving giving ourselves the time. I mean, in residency, we are, if we're lucky enough to be in a residency that gives us the time, that's great. But beyond that, beyond training, I think we have to create the time, take the time to reflect, and if that involves writing.
Mm-hmm. You've written about these exercises as being kind of brief but sustaining. And I'm wondering if there are clinicians listening, how they might get started. How could they sort of bring this into their lives without it feeling like sort of one more thing on the to-do list that already
Mhm.
feels overwhelmingly long?
Mhm. Well, again, I'd bring up the research, and it's very brief interventions. In terms of getting started, in the book, there's 30 chapters with at least 3 prompts per chapter, so there's almost 100 prompts. But a good way to give yourself your own prompt is just to, keep I used to say notebook and pen, but now it's our voice recorder or our notes section of our phone where if there is an interaction that kind of sticks in your craw, you think there's something more there you want to think about or explore, to just jot it down. And then when you have those 15 minutes that we talked about, then you won't be sitting there thinking, oh, what should I write about? What should I think about? It'll all be there for you, ready to explore and process and interpret.
And what is your kind of daily writing practice? Do you have something that you try to do every day or an approach that you take? How do you operationalize this in your own life?
Yeah, I'm a morning writer. Yeah, I don't set an alarm, but I get up at 5 o'clock pretty much every day and write before the day gets started, before the grandchild gets up. Um, and I mean, that works for me. If I don't do it, which is very rare that I don't, it doesn't feel right, doesn't sit right, just the same as if you're a runner, if you don't run, if you're a swimmer, if you're a meditator. There's things that once you're in the habit of them, once you're relying upon them and they're part of your being, it feels odd when it doesn't. But you will figure out. In the last chapter, I talk about where do we go from here? How do we fit this into our daily lives? And I may be a morning person. It may feel better to you writing at the end of the day. Try to just kind of go over things, empty your mind so you can get to sleep. Whatever works for you. For me, it's morning. And sometimes it's very boring and dry, and I think, well, I guess nothing happened. I guess I am not thinking too deeply about anything. But then there are other times that things occur like a lightning bolt, and I'll have an inspiration for an essay I might want to write, or a whole essay will write itself. That's exceedingly rare, but um, it's 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 not magic every time, but it's my routine.
Well, one of the ways in the end of my book, I write about sort of this legacy we can create into future generations. And in my case, it's how do we relieve guilt? How do we move away from guilt and not pass it along as a legacy, especially to our daughters and other young women? And I'm wondering about this legacy of writing in your own life. You mentioned when your grandchild wakes up and this idea within your own family structure. Do you find that this has created other writers in your family? Is this something that you think has been passed along, or do you see more your resident family as your legacy in the writing process?
Well, my son, who's a mathematician, is writing a book about the history of math. And my granddaughter, what she has taken to doing is sitting at my desktop and opening one of her picture books and typing the words in. And then at the end, she will write by Nana, by her. So we've had discussions about plagiarism. And she'll create her own books. She created a book the other day writing about feelings, and she stapled that all together and she put it in a box in the kitchen with $2 a piece. So she's got the marketing aspect of it down as well.
I love that. I just heard that my one of my nieces has been writing sort of chapter excerpts, almost like Mark Twain with his pieces that he would sort of write, or Charles Dickens, Great Expectations, what have you, and that it does make me think. When you have writers in your family, it just opens up this opportunity that is something one can do, and to think about your legacy, a number of different books that you've written that are out there in the world, these writing workshops and all these connections with providers. It's truly a remarkable legacy. I hope that you give that some attention and some reflection as well, because it's really, really wonderful, I think, for healthcare providers to have an advocate like you trying to help us through with burnout and with the challenges that come with modern medicine. So I just wanted to say thank you for that work.
Well, I would just say the way it came about was me looking, I hadn't retired, but I was looking towards retirement and thinking, not panicking exactly, but thinking, who am I going to care for now? What am I going to do? How can I still, if I retire from clinical care, how can I still give back? And I'm lucky enough to be friends with Suzanne Coben, who is the writer in residence at Mass General Hospital, and she's been a great mentor to me over the many years. And I approached this residency program, which was the first job I had out of my residency, and said, have you thought about maybe having a writer in residence on faculty? And here's what I think I could offer. Um, and we went back and forth a little bit, and I had envisioned helping residents write op-eds for newspapers or personal essays as part of they have to do an area of concentration where they, at the end of the month, they do some kind of paper, some kind of research project, or just a written summary. And I thought, well, it could be an op-ed, it could be an essay. And then I've done these narrative medicine sessions. And over the years, I've been at it 5 or 6 years now. It's really settled into this is what they need. This is what they want. The narrative medicine, the reflective writing, the reflection part of it, as opposed to just getting across their ideas.
Awesome. Well, again, everyone, the book is called A Prescription for Burnout, Restorative Writing for Healthcare Professionals. And Dr. Roy-Bornstein, how can people find out more about your work or maybe even attend one of your workshops in the future?
So all of that information would probably best be found on my website. I have my events listed and the book is there. So it's www.carolynroybornstein.com, which I'm sure will be in the show notes.
Absolutely. Well, thank you so much for this wonderful conversation, the work that you're doing, this terrific book, which I agree has so many helpful prompts to kind of get you started when you just sit down and you think, what could I possibly write about today? So I will be using them long into the future. And thank you again for joining me.
Thank you.